Thank you once again for the kind invitation, no? And especially Professor Chan, who has been emailing me about this talk. So I'm here to talk about invasive therapies for tremors. I decided to talk about tremors in general rather than focus just on essential tremor. So some disclosures. And the objective of this talk would be basically to present the invasive therapies for tremors. So this has been described by the first speaker, so I will not discuss what tremor is, but let me just show you some videos. And as you can see, there's tremor when the patient was doing the Archimedes spiral, no? And the severity would also vary from patient to patient. And if you look at the spiral, then you see the squiggly lines, no? And what about these different patients? So the first patient has some head tremor and some resting tremor. The second one has a more um, irregular, non-rhythmic type of tremor. And you see this other patient as well with a milder form of resting tremor. So the second patient has Holmes tremor. He suffered a brainstem stroke and thereafter presented with these irregular tremors. And these two other patients has Parkinson's disease. So these are some examples of the invasive therapies for tremors, but we'll focus more on deep brain stimulation and focused ultrasound. So according to the European Academy of Neurology and the International Parkinson's and Movement Disorder Society Task Force on treatment of Parkinson's disease, um, the green one, so we offer DBS of the subthalamic nucleus for patients with advanced Parkinson's disease with resistant fluctuations, the motor fluctuations. For early Parkinson's with early fluctuations, consider offering DBS, and same for PD with treatment refractory tremor. For early Parkinson's without fluctuations, we do not offer DBS, no, STN. And then, so same thing for the globus pallidus, for the GPI DBS. Consider offering for patients with advanced Parkinson's disease with resistant tremors, and same for PD patients with treatment refractory tremors. Because as you know, there are cases wherein we cannot do subthalamic nucleus DBS, right? And then down the line. For the levodopa carbidopa gel infusion, then for advanced Parkinson's, we offer that. And if you look at MRG focused ultrasound or magnetic resonance guided focused ultrasound, or what we know as HIFU, high intensity focused ultrasound, so PD with predominant unilateral symptoms, consider offering, but with strong limitations. No? But remember that this was way back in 2022, so they probably started, doing the papers and researching about all the papers probably 2021. So we haven't had any updates, no? And if you look at the quality of life and then down the line, you can download this paper in 2022. So large effect for DBS with for advanced Parkinson's in terms of the quality of life and then down the line. And if you look at the focused ultrasound, the effect is not as good, no? Small important effect. So we all know this patient, and the patient underwent DBS, and the tremor actually, practically disappeared. No? So he's almost back to normal. So let me talk a little bit about DBS in the Philippines. As you know, so our healthcare system is not subsidized by the government. So all DBS surgery would be under private hospitals. Except that recently we started doing it in PGH. So, but that was just this year. So in terms of the improvement in the UPDRS, you can see that there is improvement. And on the third year, after the third year, there is worsening again. And this was because early on, we were using the non-rechargeable batteries because that was the only one that was available. And then after that, then we had to do another surgery. But if you look at tremors, there is marked improvement in the tremors over the last 3 years. No? And this was way back in 2018. So in terms of the different papers, we only had papers from China, from Taiwan, and Japan and the Philippines on DBS in Parkinson's disease. So what are the outcomes and adverse effect of DBS on the VIM or the VIM in patients with essential tremor? So DBS, but this time for essential tremor. It's an efficient and safe surgical method in essential tremor. Efficacy was not affected by the body distribution of tremor, age at surgery, and disease duration. No? So lower scores more likely indicate greater improvement, and the effect of the VIM DBS declines over time. What about this international survey of DBS in Asia and Oceania? So this was from the DBS think tank way back in 2020. So the problems were appropriate referrals, access, infrastructure, and the presence of a full multidisciplinary DBS team would be the common limitations of DBS in Asia. Most centers in China, Japan, and India perform less than 10 cases per year. And a future study is expected to address the impact on the quality in centers performing such few cases. So we actually did a survey among our ASEAN colleagues. And in terms of the clinical experience, Malaysia had more, about 18 years. I'm not sure why Thailand was 10 years at the time. I think it should have been more. And in terms of the number of cases, they were actually doing more DBS cases than the rest of the ASEAN. So average hospital stay would be about 1 week for patients. It's usually bilateral STN, unilateral STN for one patient in the Philippines because the patient had a palidotomy in the US. And most would be bilateral STN DBS for Parkinson's disease. And in terms of HIFU or magnetic resonance guided focused ultrasound, but this was way back in 2020, I think. There's one center in Thailand and one center in the Philippines. And in Thailand they did 2 cases, but I think this should have been more. And in the Philippines, as of now, we've done 20 HIFU cases, 4 XDP cases, and 16 Parkinson's cases. So same thing, the limiting factors by country basically would be funding, except for Singapore. Patient factors, poor referral network, lack of specialized centers, and lack of clinical experts. So let's talk a little bit about magnetic resonance guided focused ultrasound. So the HIFU beams are targeted to an intracranial region using a hemispheric phased array of transducers that is fixed to the skull. So it allows the passage of ultrasonic waves through the maximum available skull area, thus avoiding overheating and brain damage. So the patient is on the MRI table, and then there's a device that's put on the head, and through the operator, the neurosurgeon, and the physicist, so they compute for the dose of the ultrasound waves. So the device is also coupled with a dedicated software that allows for the correction of phase distortions, aberrations of ultrasonic beams, and the ultrasonic mechanical energy is absorbed within the focal target volume and converted into heat that causes the destruction of the tissue. So the first picture was with Professor Chang of Taiwan and Professor Taira of Japan. So we did the first XDP case in Taiwan, and this was in Manila. So treatment for tremor, whether pharmacological or surgical, should be utilized when tremor interferes with the quality of life and daily function. So it's an effective and safe treatment option for medically refractory essential tremors. And it should be considered a treatment option for those who can provide informed consent, who understands the benefits, the risks, and the alternatives, right? So, what about the statement of the American Society for Stereotactic and Functional Neurosurgery? So, um, they were saying that the, 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 the availability of the evidence-based best practices for the use and the implementation of this treatment modality, the indications would be outlined, including confirmed essential tremor diagnosis, failure to respond to first-line therapies, disabling appendicular tremors, and unilateral symptoms are detailed. Okay, the contraindications are also actually discussed there. So, what about this one? Unilateral thalamic DBS versus focused ultrasound for essential tremor. So, in summary, it's almost the same, except that, of course, with DBS, you do the open surgery, and with MR focused ultrasound or the HIFU, you do a unilateral lesion. So, MDS review for essential tremor. So, for surgery, unilateral VIM, bilateral VIM, likely efficacious for bilateral VIM. There's insufficient evidence. Unilateral radiofrequency thalamotomy, likely efficacious. Unilateral gamma knife, insufficient evidence. And for the HIFU, unilateral likely efficacious, no, for essential tremor. So what about the outcomes and complications? So a lot of um, the improvement were assessed using the CRST, the Quest, in assessing the severity of the tremors. But in procedure, complications would be, some patients would complain of headache, dizziness, nausea and vomiting, sensation of heat and warmth or flushing, and scalp tingling, and even paresthesias. So a meta-analysis in 2022 showed a sustained efficacy of the HIFU for the treatment of essential tremors. No, so pre-op scores, and then at 3 years, there's definitely improvement. No, sustained improvement. So same thing. And follow-up of 3-year follow-up prospective trial. So say the in terms of the baseline score, the tremor would be, the median score would be about 20, and at 36 months, it's down to just about 8. No? And in terms of the quality of life, there's definite improvement. So let me show you this particular patient. So we did the left HIFU, left thalamotomy, and you can see the right hand tremor has completely disappeared. And the beauty of HIFU is that the effect is immediate. So same thing, Parkinson's. So the left hand, the postural tremors has completely disappeared. So what about the outcomes and complications? So again, the nausea, there's the dizziness. You saw this particular patient, and there's actually improvement of the right hand tremors. Our problem with this particular patient is that the skull density ratio, or the thickness of the skull, was a little low at 0.37. So the patient was complaining of headache every after sonication. No? But he was, he persisted. So there's really improvement, and it's been 6 months, and so far, so good. Okay? So this particular patient, he experienced moderate to severe headache during the sonications. The skull density ratio is 0.37. So we want a higher skull density ratio at about 0.45. No? So same thing, the side effects in some papers would be paresthesias, ataxia, imbalance, unsteadiness. We had 2 patients who complained of weakness of the extremity. And when we did the post-op MRI, the lesion was actually a little bit bigger than we hoped it would be. So we started DEXA, and over time, the patient actually improved. I think it's partly the swelling, no, the edema. So it's a little bit big. So in summary, DBS STN should be offered to eligible patients with advanced Parkinson's disease with resistant fluctuations. We consider offering DBS STN to eligible patients with early Parkinson's disease and early fluctuations, PD patients with refractory tremor. We consider offering GPI DBS to eligible patients with advanced PD with resistant fluctuations or PD with refractory tremor, and consider HIFU with strong limitations to patients with PD with predominant unilateral symptoms. Unilateral HIFU likely efficacious with acceptable risk. Unilateral VIM DBS likely efficacious with acceptable risk. Bilateral VIM DBS, there's insufficient evidence. So ET HIFU, again, would depend on the skull density ratio. So we need a separate CT scan with additional filters that the technician would actually apply so that they can compute for the skull density ratio. On the latest meta-analysis, there's sustained efficacy for up to 3 years and follow-up. In terms of adverse events, there's in-procedure dizziness, nausea, and vomiting, paresthesias between 0 to 3 months and even up to 12 months, ataxia between 0 to 3 months and at 12 months. For our XDP patient, we had 2 patients who complained of central pain, no? But the target was different. It was the pallidothalamic tract, but there's some pain involved. So ataxia at 0 to 3 months and up to 12 months. In terms of future directions, I think medications will always be a mainstay. I mean, not a lot of patients would actually want any surgical procedure, even if it's incisionless. So DBS will remain. The main issue, at least for us, would be the cost, the invasive nature, as well as the age limitations. Although earlier, Tian did present an 80-year-old patient who underwent DBS. So more patients will probably want the HIFU due to its incisionless approach, but this has to be tempered due to its limitations as well. More targets probably will be tried, but it has to be under a study with the IRB approval. So with that, thank you very much and good afternoon.